Everybody, this is Dr. Ty Vincent, another LDI-oriented video. This one is about eosinophilic esophagitis, which, if you've tried to say it, is challenging. Luckily, the treatment of the disease with LDI is not challenging, turns out. This is a pretty simple and focused topic, actually. If any of you have that condition yourself, or more likely, you're a parent who has a child who's been diagnosed with EoE, eosinophilic esophagitis, this should be interesting to you. So this is usually someone, kid or somebody else, who complains of a lot of heartburn sort of symptoms, maybe pain or discomfort in their chest after they eat, perhaps obvious reflux or vomiting or something, because it's within the esophagus, right? So we're not talking necessarily about someone who has diarrhea or nausea or gas or bloating or constipation or any of those downstream gastrointestinal things, but you could. A lot of people who have EoE also have other digestive inflammatory symptoms. A lot of them have eczema, so you can have that, which is often an allergy-related problem. A lot of them may have asthma or environmental allergies that are obvious too. So people with allergic tendencies tend to have allergies, just the way it goes. Eosinophilic esophagitis, if you've been diagnosed, means that you had a upper endoscopy done by a gastroenterologist usually, or a pediatric gastroenterologist if it's a kid sometimes, and they did biopsies and they saw within the mucous membrane lining of the esophagus an abundance of these cells that are called eosinophils. Eosinophils are a particular type of white blood cell in the immune system. They're called eosinophils because they stain very heavily with a pinkish red cellular stain called eosin. That's all. Okay, that's what eosinophil means. If you try to look it up, like, does that have anything to do with a particular type of germ or nutrient or metabolic process? No. It's just that they like the color red or pink in this staining method. That's it. So those white blood cells tend to react preferentially to certain kinds of things. They respond to allergic influences, they respond to fungi, and they respond to parasites. And that's pretty much it. You can get some weird idiosyncratic reaction patterns where this or that cell type seems to be part of the response, but it's unusual. But if you see high eosinophils in somebody's blood test, for example, it generally means they're having an allergic reaction to something, they have a fungal infection, or they have a parasitic infection. One of those three things, which are still broad categories in and of themselves. I've treated a lot of patients now who have been diagnosed with EoE, and so far, with no exception that I can recall, the ones that have responded, which is the vast majority of them, have all responded to foods. They've all responded to the food allergy LDI mixture, or before I developed that, they responded to the LDA food mixtures just beautifully. So as far as my experience goes now, April of 2020, having used this treatment for more than a decade, it seems to be basically food allergy, a manifestation of food allergy in the vast majority of people. Now, if you had, or your child had food allergy testing by their allergist or their gastroenterologist or what have you, and it turned up negative, that's meaningless. It doesn't really matter because allergy tests are just not very accurate. And if people have a certain kind of allergic response, the allergy tests are most often positive. Like if they have elevated IgE antibody in the blood to a certain food, then they'll probably have a positive skin test to that food too. But a lot of allergic reactions to foods and other things don't manifest as a skin reaction. They don't manifest as IgE antibody. And since eosinophilia, in this case, that you see in EoE, is an entirely different immune response profile, it would not be unusual at all for a kid or an adult with EoE to have negative food allergy testing when you're looking at skin reactions and IgE antibody, because it's not even that kind of a reaction, right? It's a cellular reaction with a totally different cell type. Antibodies are made by plasma cells, which are previously to that were B lymphocytes, not eosinophils. And skin doesn't hold the eosinophils that live within the GI tract. So don't get confused or derailed in this theory by an allergist who says, nope, your kid doesn't have food allergies. If your child has EoE, there's a really good chance, from my experience, that they do in fact have food reactions, and that's how it's manifesting. So from an LDI perspective, the treatment of EoE has been very simple so far to date, with dozens of these kids and a handful of adults, in that we just go through the food mixture, until we find a dose where their symptoms stop occurring. If they have specific foods that they can tell, or you can tell, definitely trigger their symptoms, that's great. That makes it even easier, because then we can use those key foods as our guide for when we have gotten the dose correct. You give them the LDI dose for whatever dose of the food mixture we start at. 6 or 7 days later, you feed them some of their trigger foods. You see if they react the same as usual. If they do, we go to the next stronger dose, and on so it goes, until we give them a food dose, and then you say, oh my gosh, this time all of their symptoms went away, and when I gave them their trigger foods, nothing happened. It seems like they're completely normal now, because that's what you'll see. I've had a couple of parents who took their child after we reached that point to have a repeat endoscopy done, which I don't advocate, because if your child's become asymptomatic and they're doing great, I don't see the reason to subject them to an invasive procedure like that that's expensive and traumatic and has its risks, right? But there have been a couple of parents who the cost wasn't a barrier to them, and their doctor still wanted to repeat the test, and they just went along with it. And in both cases where the LDI had eliminated their symptoms, they had no eosinophils anymore on their follow-up biopsy, which is great. That's what we'd expect to see. And it's confirmation that that immune response was indeed stopped. The gastroenterologists said, that's impossible, that just doesn't happen. And then they just walk away without taking any special interest in how it in fact did happen for those individuals. But I'm sure you're used to that. The disinterest of specialists when something gets better that isn't supposed to. So if you or yourself have been diagnosed with EoE, have other similar things like I mentioned, these other gastrointestinal symptoms that seem inflammatory or immune related, eczema and skin conditions and asthma, we have a high rate of success treating all of those things with low-dose immunotherapy, or other kinds of immune desensitization. If you have a practitioner who utilizes some other method, give it a try. But it's generally going to be food associated. If an EoE patient at some point does not respond to foods, the other things to try, like I mentioned at the beginning of this video, are yeasts and parasites, because those can also elicit an eosinophilic response. So hopefully that's helpful for somebody out there, and we'll see you next time. Thanks.